invite Dr. Shweta Parakh for her next presentation on intraocular inflammation following intravitreal faricimab or experience.
Good afternoon, everyone. I will be presenting on IOI following intravitreal faricimab. Faricimab is a novel bispecific monoclonal antibody that targets both VEGF-A and angiopoietin-2 and has been approved for wet AMD, DME, and retinal vein occlusions. Ours was a retrospective case study carried out over a period of 8 months. All patients underwent thorough pre-op and post-op injection evaluation on the given days. In our series of 26 eyes with 24 patients who were injected, maximum number of 2 injections of faricimab were given, and we have seen 3 cases of IOI following injection faricimab. This is in comparison to 3 out of 42 eyes of injection brolucizumab that were given at our center, which had IOI. Coming to the cases, 73-year-old male with bilateral IPCV and who had received 10 intravitreal Eylea injections in the past, was not responding well to the injection, and the decision was made to switch to faricimab. However, on the 7th day post faricimab, he presented with vitreous cells 1+, and he responded well to treatment with topical prednisolone acetate. There was no evidence of vasculitis or vascular occlusion. The second case was that of a 68-year-old lady with wet AMD OS and who had received 4 intravitreal ranibizumab, 12 Eylea in the past. There was a history of mild vitritis following 1 injection of brolucizumab in the past. She was made to switch to faricimab in view of non-response to other injections, and she presented similarly with vit cells 1+ on day 7 post-intravitreal faricimab. There was no occlusion, and topical steroid therapy was used, and she responded well. 81-year-old lady, this was the last case of a wet AMD patient who presented on day 1 injection post-faricimab with multiple pigmented KPs and no evidence of vasculitis or vascular occlusion. She also responded well to treatment with topical steroids. She happened to be suffering from osteoarthritis and she was on treatment for the same. Reports of IOI following injection faricimab are uncommon. They are statistically higher than that of the Eylea group, but not as high as pegcetacoplan or brolucizumab group. This was a case series of 71 eyes which showed similar presentation to us in the form of mild vitritis without vasculitis. And there have been reports of severe IOI in this case series of 3 patients from a single institute, one of whom required a therapeutic vitrectomy on the first day following presentation. There have been reports of bilateral occlusive vasculitis following injection faricimab and also those of uveitis. Sterile IOI can present either as a severe acute onset inflammation mimicking infectious endophthalmitis or a delayed onset inflammation, which has been seen more with injection brolucizumab and pegcetacoplan, and more in the form of an occlusive branch arteritis at branch arterioles. A history of uveitis, the use of pro-inflammatory prostaglandins, and the history of diabetes and AMD can also contribute to IOI. The presence of treatment-boosted anti-drug antibodies, especially high after brolucizumab, also lead to high incidence of IOI. The FC region of the anti-VEGF molecule is a highly immunogenic factor, and it is noticeably absent in the ranibizumab molecule. Faricimab has a modified FC region which reduces the incidence of IOI. Bacterial endotoxins, impurities, and proteins from other human sources, syringe agitation, freeze-thawing processes, shipping and handling may all contribute to IOI. Steroid therapy forms the mainstay of treatment. In severe cases, even vitrectomy may be warranted. In order to compare with the incidence of IOI following brolucizumab-induced injections, this was a meta-analysis of 31 reports of 41 patients with 46 eyes, average age 76 years old, with 58.5% being female, and IOI occurring at a median of 37 days after treatment initiation with average of 2 injections. To summarize, at our center, we have come across post-injection faricimab 2 cases of mild vitritis and 1 case of anterior uveitis. and there was no associated retinal vasculitis or occlusion, and they responded well to topical steroid therapy. There was history of IOI in one lady following IVT brolucizumab in the past. This may have made her more prone to IOI. In conclusion, drug-induced uveitis is a rare adverse effect of drug administration, and early diagnosis and treatment can prevent severe visual impairment. There have been few reports for IOI following injection faricimab, and steroid therapy forms the mainstay of treatment. Thank you.
Thank you, Dr. Swati.
Shweta. Thank you, sir.
Yeah, one point you also pointed again that one patient who has had brolucizumab and reacted or had some reaction because of that.
Yes.
Don't you think we should have been more careful in injecting?
Yes, sir, definitely.
Or not injecting, or thinking second time, twice before injecting?
Yes,
because
sir.
maybe that patient was prone for infection.
Sir, I agree, but we had run out of options as far as the treatment was concerned, and there was absolute non-response. In fact, after the IOI following brolucizumab,
So did you
she
take
was
any
switched back to
special-
Eylea.
Did you take special precaution for that patient who has
I
had
agree,
some
we should
reaction?
have maybe preemptively put her on topical steroid therapy. I agree, we should have done that.
And some conjunctival swab, etc., microbiology of the
No,
conjunctiva.
sir, there was
lead-
no infective etiology as such, but I agree, we could have at least put her on topical steroid therapy preemptively.
So, do we need any precautions so that we should try these injections, faricimab and brolucizumab? Precautions, which patients are in which
More
we
prone.
should be precautious to use these?
Those with using prostaglandin analogs, AGMs in particular, those with history of AMD and diabetes, yes, theoretically, yes. Especially those with a history of uveitis, then be more careful.
And some systemic issues, as in one case you have shown
Rheumatoid.
that rheumatoid arthritis.
So that is one angle that we are just trying to explore. The patient was anti-CCP, anti-RA factor also negative. We were trying to explore and look into that angle. Is there any, so far we have only come across 3 cases, not come across any other patients. In fact, in the IOI series of brolucizumab injection, one patient had vasculitis with disc edema and happened to be suffering from Crohn's disease. Although it's not enough to come to a conclusion, but we are looking into that also well.
Thank you.
One more thing, just for the audience. On the contrary, in brolucizumab studies, they have said the incidence of IOI is less in diabetics as compared to non-diabetics. Okay, on the contrary.
Yes, sir.
Thank you.
Thank you, sir. Thank you.